Hi, everyone. Welcome to this week's episode of the Radiance Revealed podcast. And I'm your host, Dr. Jen Haley. And with me, I have my dear friend, Swati Kannan. She is an assistant professor at UCSD and a cosmetic dermatologist. Welcome to the show.
Thank you so much, Jen, for having me. I'm so excited to be here.
Me too. Me too. So I have a rule I've always had since I've been a doctor that if someone could do a better job, I send the patient to them. And that's why I have you on the show today, because I want to talk about aesthetic treatments. And you are one of my top favorite aesthetic
Oh my gosh,
dermatologists.
I'm so flattered. Thank you.
Yes. So you're one of the top probably 3 or 4 that I go to. So I wanted to, because you're young in your career, but you're extremely knowledgeable and you're on the cutting edge.
Thank
So
you.
when I thought about 2024 and discussing top 3 aesthetic technologies that you're super excited about being in the space that you're in San Diego, you're the one I wanted to reach out to. So thank you for being here, and let's get started with that.
Sounds great. No, thank you so much for having me. I feel so flattered. So I think 2024 is going to have a lot of different changes compared to what we've seen in the past. I think that one of the biggest things I'm noticing in my practice already is that people are moving towards tightening treatments and less towards filler. I think for the last 20 years, we've focused on just putting hyaluronic acid filler in patients' faces to help lift and to help tighten and to volumize, but now we're moving away from it. So one of the newest devices that we've had now for about a year or so is called Ellacor. It's a micro-coring device, and what that means is that it uses these tiny hollow needles to remove tissue from the lower face and neck, and it causes tissue tightening. The cores of tissue we remove are about 0.5 millimeters or less. So you can imagine like tiny little punch biopsies. And then that causes tightening without leaving any scarring. So that is the whole premise of Ellacor. And we describe it as the closest thing to a facelift without surgery.
Right. So it appears to be like a diffuse kind of facelift. So instead of just
Mhm.
removing skin from the periphery of the face and pulling it back, you're almost, when I see the procedure, it looks like you're aerating the lawn, where you're pulling out these little plugs of tissue throughout the skin, and then that tissue can close on itself without really forming a big scar, and it tightens in the process.
Yeah, that's a great analogy. So exactly. So when we think of the typical facelifts, they kind of do a deep plane or superficial plane where they're just kind of cutting and pulling it back. But those facelifts can't really address, for example, the wrinkles around the mouth or the cobblestoning texture or even some of the fine lines, right? Because it's just causing tightening of the jawline, mainly when you do a facelift. The nice thing about Ellacor is that you can get the tightening isn't like a facelift, but you can get some tightening, but then you also get softening and improvement of the lines around the mouth, the cobblestoning texture of the chin. And those are so difficult to treat in general anyway. So Ellacor, just for the perioral area, like the smoker's lines around the mouth, it has completely changed like what I do in my practice.
Okay, so perioral is around the mouth.
Like
You know, we're
around the
we're
mouth.
we're talking, we're kissing, we're chewing all day long, and the movement of those muscles, as the collagen deteriorates, the skin doesn't bounce back as quickly. So even if you're not a smoker, the lines sometimes will stay there. After years and years of being alive. So, okay, who's the ideal patient for this Ellacor treatment? And then can you walk us through the treatment? Like, who's a good ideal
Yeah.
patient? Who's not an ideal patient?
So the best patients are skin types 1, 2, 3. And so those are the lighter skin patients. So anyone that's my color or darker, I would not treat yet because we don't have enough evidence to see how much discoloration they can get. So anyone that's a lighter skin type, I don't have age ranges specifically because we all age differently regardless of our age. But anyone from like soft wrinkles, so just when you're starting to see the folds, all the way to the more severe wrinkles. Of course, the more wrinkles you have, the more number of treatments you need, and I'll kind of get to that in a second. Patients that are not good candidates are basically somebody that looks like me or darker, and that's because we haven't studied it. And anyone who doesn't really have a defined fold. So if you have a lot of heaviness and fat, Ellacor is not going to work for you. You need more like liposuction and then tightening afterwards. It's very fatty down here, Ellacor won't work. If you have if you have a tight jawline, but you have what's called the banding of the platysma, where we see the turkey neck, Ellacor won't work for that because the reason you have the banding is because of the muscle issue, not the skin issue. So Ellacor is good for collagen production. So anyone that has severe wrinkles caused by collagen deficiency would benefit from Ellacor.
What about someone who's lost a significant amount of weight? Because I find those patients to be the most difficult over the years. Like tightening lasers are really unsatisfactory, and time only improves so much. And we're seeing a lot of that with Ozempic face. Do you think those patients that maybe don't have a lot of fat under the chin, like you just mentioned, would they benefit, assuming their weight is stable?
I think they would need more treatments. And the
Okay.
reason is not only do you need the ability to produce good collagen, so you need slightly thicker skin. And what I have found is that patients who have incredibly thin skin, while they do respond to Ellacor and some respond really nicely, the results are still quite variable. And patients who tend to have thicker skin with the ability to produce more collagen respond better to Ellacor than patients who have very thin, incredibly lax skin, which is what I envision from, fast weight loss or the Ozempic face.
Interesting. Okay. So I just want to go back to the darker skin types just so people understand. So we've talked about post-inflammatory hyperpigmentation on this podcast before. So is that the concern that we're seeing with this? So just to recap for anyone who hasn't listened to previous episodes, basically anytime there's inflammation in the skin, and I'm half Spanish, so even though my skin is fair, I have this tendency of my skin. So I completely get it. So when there's inflammation, whether you have a pimple or a cut or any sort of trauma to the skin, all of the melanocytes, our pigment cells, think there's a party going on, and they go run off to the site and they leave a dark spot. So in a procedure where we might want to get some benefits to wrinkles, sometimes we're left with a brown spot. Is that what you're concerned about?
So that is a great explanation. I'm worried about post-inflammatory hyperpigmentation, but I'm also worried about post-inflammatory hypopigmentation. So
Mm.
when you get that whitening of the skin that some darker skin types can get, even if patients have a little bit of Spanish or Asian in their skin type, I still do Ellacor and I pre-treat those patients with hydroquinone, which is a lightening agent. And I feel like it really decreases the risk of the discoloration. However, with the darker skin types, because I'm also worried about hypopigmentation, which is much harder to camouflage and prevent, that's one of the reasons we haven't tried it. I suspect, though, that if they did get hypopigmentation, it would go away, right? Because most of even the laser-induced hypopigmentation tends to go away. But we just haven't tested it. And I think it would look really strange to have like little like dots, right, on the face
Yeah.
versus hyperpigmentation, which is easy to treat. I think as a skin of color dermatologist, I'm not afraid of hyperpigmentation anymore because almost all of my patients are darker skinned. I live in San Diego, so I have a lot of techniques to help prevent hyperpigmentation or to treat it once it happens, but we have very little to treat hypopigmentation. And so that's more my worry.
Yeah, I agree with you. I think it's a lot easier to remove things from the skin than put things
Mhm.
back. So like when we think about stretch marks, it's loss of elasticity.
Right.
That's a lot harder to treat than a brown spot that we could fade. But like a white area where there's no pigment is a lot scarier for us because we just are
Yeah.
praying it comes back, and the body does its magic.
Right.
So
And I think it does for most patients, but is that a risk we want to take on the face? I not yet.
especially with a procedure that's causing a pattern on the face, because it would be really evident when you're talking to other people. So at the end of the day, we always ask ourselves, like, why are people doing these procedures? And it's really, we want to connect more with others. And if we're doing anything to prevent people from connecting better with others, we're doing them a disservice.
Yeah, I think that's a great way of why we do cosmetic treatments, right? I think that's a really
Yeah,
beautiful way of saying it.
it's true when you think about it. Okay, so can you walk through the
Mhm.
procedure, because it's a little more heavy duty than I think a lot of people understand, but
Yes.
yet it's not a facelift, right?
Correct. So after having done so many cases, I actually feel that Ellacor is a lot less cumbersome than doing hardcore laser resurfacing, which is what we used to do before Ellacor for skin tightening. So it's much less recovery, much less downtime, and much fewer risks than hardcore laser resurfacing. The first thing is numbing. So, how painful is this procedure? So, we have three ways of numbing the patient for Ellacor. One is just topical numbing. You come in, we apply a cream to your full or to the lower face, and you leave it on for about an hour and a half. Then we have to go in and do nerve blocks, which are like the blocks that even dentists will do to numb a local area. So, we do nerve blocks. Once the nerve blocks are set in, we then have to do lidocaine injections, which are little injections into the skin that kind of help numb that entire lower face and all whatever treatment area we're doing, whether it's the lower face, around the mouth, or a little bit on the neck. Once the patient is completely numb, then the treatment is not painful because there's lidocaine underneath the skin. And as you were mentioning, it creates a pattern. So it's basically like a square shaped grid with hollow needles, and it's attached to a vacuum. So we stretch the skin tight. The skin kind of gets suctioned onto the vacuum. And then when we press the pedal, the device will kind of inject the needles and pull them out rapidly to then remove the cores of tissue. So it's basically like needles are injected and then a vacuum suctions out cores of tissue. It sounds a lot more violent than it really is. I think lasers are a little more aggressive. Once a treatment is done, patients have like a bruise-like pattern or bruises in a grid-like pattern, kind of looking like, I call it like a beard. It looks like a beard or, a goatee or whatever we end up treating because it's kind of in that area. The first few days, it's very bruise-like, but by day 4, day 5, that has gone down substantially, and by day 7, patients are a lot less red. The main thing I've seen, though, is that patients get this residual redness, and that redness can last upwards of 3 months or longer. It has always gone away. I've never had any patient where it's been permanent redness or permanent discoloration. But that is the one thing that we've noticed. And if I see that, then we'll start using certain lasers that target the redness. And sometimes I'll do like a Fraxel treatment, which is a resurfacing laser, just to kind of help shed some of that iron staining that we think is causing the redness.
Sorry, I didn't mean to cut you off.
Yeah,
I'm
yeah.
just wondering, there's some thought that this inflammation that's going on after the procedure, we might want some of that it might be doing something at a cellular level to help regenerative processes that we're not necessarily aware of. What are your thoughts on that?
So probably, I mean, anytime we have scarring, we want to see what kind of inflammatory process is caused. I mean, I'm going to call it scarring, even though Ellacor is technically scarless, meaning we don't see visible scarring. As it tightens, it's still producing collagen to tighten. And when it's producing that collagen, we always want to make sure that whatever inflammatory process is happening is producing the right kind of collagen, which in the case we want is type 1 collagen. If we have inflammatory processes going in the other direction and it's causing a scar-like collagen, which is type 3, we don't want that. I think the reason we get redness from Ellacor is because when we're removing the cores of skin, there's blood getting stuck in between in those cores, and it's releasing iron. So it's almost like a hemosiderin deposition versus a true post-inflammatory redness. There's also no heat from Ellacor at all. And so when we don't have heat, one, it causes a lot less inflammation. So, there is something about having heat that we, tend to have with laser resurfacing. That heat is useful for collagen regeneration, but that heat also causes residual redness. So that's what causes a post-inflammatory erythema with lasers. And so we don't have that in Ellacor. So we're thinking that it's a hemosiderin deposition. The weird thing about Ellacor is that let's say I did treatment on day 1 and they had redness, then if I do a treatment 4 weeks after the first one, the redness goes away. And so and we think it's because when we're doing the second treatment, it's removing the iron out. And so maybe helping with the redness. But we're still, still in the early process. So we are all in a Ellacor chat group, and we all kind of chat about what we can do to kind of improve the outcomes and reduce the redness, which I think is the biggest issue with Ellacor.
Right. And I mean, for those of you listening, wondering what hemosiderin is, basically our blood has iron in it. So it's basically the iron molecules in the blood. And that's why, like, sometimes on the bottom of someone's legs, when they don't have good blood flow, the blood vessels get leaky and can stain the skin a little brown. That's what we're talking about when we say the words hemosiderin. And my understanding is that's why you're doing the injections of the lidocaine with epinephrine before the procedure, as opposed to just putting someone out, because you want to kind of constrict those blood vessels so they're not as leaky during the procedure.
Exactly. Yeah. And then patients who are on blood thinners, which we have a lot of our patients who want Ellacor also are on blood thinners, which I don't take them off because their blood thinners are important for their underlying systemic condition. But those patients do have a higher risk of that iron staining because they tend to have more bleeding. So really things like arnica might be helpful. We just haven't studied it yet, in Ellacor with Ellacor. But things that decrease bruising might be helpful for decreasing that iron staining down the line. But it's not permanent, so it goes away. it's just a nuisance for a few months.
That's great. Yeah, like maybe arnica, bromelain, and K2, but if
Hmm.
they're on Coumadin, they're not going to be wanting to take K2.
Exactly.
We don't want to do that. So
No.
don't do that. Okay, so you're mentioning this beard area. So does that mean you can't treat the forehead or eye bags? Because those are common. Eye bags is
Yeah.
probably the most common question I get from people.
Actually, yeah, me too. No, you cannot. So it's not FDA approved for the upper face. Now, I'm sure there are some providers who do probably do the upper face. The reason I don't do the upper face right now is because we have a lot of important blood vessels and on the upper face that are much more superficial. And those blood vessels are running with nerves that kind of run alongside, right? Especially like on top of our eyebrow and then our temples as well. And so I don't want to disrupt those vascular bundles or those important structures. So I'm not doing anything on the upper face. I mainly target the lower face. I also am very lucky. I work in a practice where we have so many devices. And so if somebody has, concerns about other parts, I can just use a safer or an option that I'm more comfortable with. I think there are some providers who are going off label and they are doing other parts of the face. I would never do it around the eyelids. I think that bruising would be so severe. Plus, Ellacor, when we're doing the treatment, it's a pretty deep treatment. So we're removing tissue from either 1 millimeter all the way to 4 millimeters deep. So that is incredibly deep. I would never do that around around the eyes
Hmm.
or the temples or the eyebrows. Those areas would be off limits. Even if people do more superficial, let's say you do like 1 millimeter, like we'll do radio frequency with microneedling, for example, and that could be 1 millimeter deep. The important thing is that those things are just creating little punctures. It's not removing skin. Ellacor is removing skin. So what if you remove important parts of the nerve or vessel? It would take the body much longer to regenerate that. So that's why I would never, until somebody does it and tells me it's perfectly safe, I am not going to experiment on the upper part of the face.
Yeah, I agree with
Yeah.
you 100%. That's the one thing I love about this company. So, for those of you who are listening, we're talking about Ellacor, which is Ellacor, is the company is only putting this device in the hands of people who are properly trained, which we don't see that with a lot of devices out there. So, even though you might believe that if someone is doing a procedure, if they're doing Botox or a filler or a laser, they're qualified to do that. Unfortunately, that's not necessarily the case. So when you're dealing with your body, you have to do your due diligence and see what kind of training the person has and make sure that they're going to do the right treatment for you. And with that being said, when you go to a center like UCSD or a center that has a lot of devices, they're going to choose the right tool for you. So it might be Ellacor for the lower face and then radio frequency with microneedling in the upper face and then something else for your neck. Whereas if you go to one place, they're going to be hitting everything with a hammer if they have only one device, right? So go to someone that has many options that's going to have your best interest at heart. And I love that you clarified the difference between microneedling and then microneedling with radio frequency and then obviously Ellacor. So microneedling is just making like go ahead.
Like little punctures in the skin. It's just like sticking a needle and just going, and that's it. And then microneedling with radio frequency, we're creating a puncture and delivering heat at that depth. So if we have a 1 millimeter microneedling device and we're creating a puncture at 1 millimeter depth, we're then delivering heat if it's with radio frequency. And then Ellacor is actually just removing that entire skin from that depth without leaving any heat. So we have to, obviously, that's beneficial in some areas where we want to remove excessive skin, like the lower face, but not beneficial where we have important structures. So we have
Right.
to
And
just
then
be careful where we use it.
I love that. And then as the skin heals, it tightens up. So
Right.
how many treatments should somebody expect to be getting?
Yeah, I usually say for most patients, it at least do 2 treatments. And I like to space them about a month apart if possible, just that, like I said before, we can remove that hemosiderin deposition or the iron deposition if it happens. If Occasionally, if patients have severe wrinkles, they might need a third treatment. But if I feel like they have really severe wrinkles, then they might benefit from a facelift and an Ellacor treatment because those are still 2 different things. If you have a lot of skin laxity, like what we talked about with weight loss, Ellacor would be helpful. But the best thing would obviously be a facelift and then Ellacor for things around the mouth or skin textural changes on the chin. But most people who are doing Ellacor are not ready for a facelift yet, and so that's why Ellacor is that in between treatment. between before people want a facelift.
And much lower risks, obviously.
Much lower risk. Yeah. We're not dissecting anything. We're not injuring any nerves. We're just removing excessive skin.
Have there been any studies looking at certain nutritional behaviors and results?
I feel like that would be a great topic for you to teach me about, because we haven't studied it from the Ellacor standpoint, but when it comes to Sculptra or using tightening devices that use heat, so Sculptra is the type of filler that helps to create collagen. Patients who are on a high protein diet are going to make more collagen from these collagen producing treatments. And of course, we know that a high protein diet will also be more helpful for healing. So when we've done studies on surgical patients on a high protein diet will heal better and faster than patients who are not on a high protein diet. But because you have a background in nutrition, I would love for you to tell me like what you have experienced or what you see.
Yeah, I mean, there's so much we don't know. I have a hard time saying facts when there's not science behind it. And we all know nutrition is one of the hardest things to study. But I do know it plays a role. And even with, PRP and PRF, I believe that the results people get with, PRP injected or PRF for hair loss does improve the results depending on your diet afterwards, if it takes or not. Okay, so anything else we need to say about Ellacor before we step into the next?
No, I mean, I think I've covered it. Can't think of anything. I do have a YouTube video on it too if people want to look at the photos of the recovery, because I think that is much harder to describe. It's easier to see in photos, but yeah,
it's a little scary, but from what I hear, it doesn't hurt as much as it looks like it hurts.
It doesn't hurt as much as it looks. I really think laser resurfacing is much more aggressive and more painful in the recovery period. Ellacor doesn't hurt after the procedure's done.
I'm going to be getting it in sometime in the next couple of years. So yeah, I'm
ready.
A little bit...
I'm ready for you.
I know. Yeah, it's so hard to go to San Diego. It'll be such a hard place to go to.
Well, you love the sun and you won't be able to see the sun. I think that's the main thing maybe I should mention is that during that 1 week recovery period, just like any treatment, you just cannot look at the sun. You have to not only practice sun protection, you have to practice sun avoidance.
Well, you could wear one of those balaclava masks. I've worn those outside.
Yeah, as long as you don't expect to look sexy afterwards, I think we're good.
No. I always say it's better to compromise the way you look 1 hour during a hike than the rest of the 23 hours. So yes.